Thank you all for joining us today for our 8th webinar in the CRWDP New Researcher webinar series. Before I introduce our panelists for today, I wanted to remind you that we will have a Q&A session after the webinar, and after the panelist is finished, we will have questions. We are we're delighted to have Dana Howse, Dr. Dana Howse with us today to talk about her research on injured workers and their moral engagement in the compensation system. This was her doctoral research that she did in Ontario. However, Dana Howse is joining us from Newfoundland, where she is a postdoctoral fellow with the Centre for Research on Work Disability Policy and housed with the Newfoundland Cluster at Memorial University. And so without further ado, I'm going to hand this over to Dana.
Okay, hi there. You can hear me, Pam?
I can.
Okay, great. Thank you everyone for tuning in for this presentation today. As Pam mentioned, I'm going to be presenting today my doctoral work, which I did while I was in Ontario. And I did that as a trainee of the Centre for Research on Work Disability Policy, where I'm now a postdoctoral fellow. So it's a nice evolution there of my research. So I'm going to talk to you today about my doctoral work, which examined injured workers' experiences with problematic workers' compensation claims in Ontario. But before I dive into that, I thought I would tell you about the surprise of sorts in my master's work that really ignited my curiosity in workers' compensation, because I'm often asked, what sort of led you into this sort of field of research? So my master's work I did at Memorial University here in Newfoundland and Labrador, and that was part of a large multi-component study examining occupational allergy and asthma to snow crab, what we called crab asthma. So basically, there were high numbers of plant workers who handled and processed crab or who worked near the crab processing areas, and they were developing symptoms of allergy and asthma. And this larger study was undertaken to measure the prevalence of the illness and to sort of explore elements of plant design and that sort of thing. And my piece of that study examined the quality of life and socioeconomic impacts of crab asthma. And that involved interviews with symptomatic workers about the effects of their condition on their work and home life. So I went into these interviews in small coastal processing communities in Newfoundland and Labrador, expecting to hear stories of extended sick leave, high unemployment, and high rates of compensation claiming. But I didn't hear those stories. No one was taking time away from work at the plant, and of the 27 symptomatic workers I interviewed, not one had filed a workers' compensation claim. What I did hear about were workers' strategies for staying at work despite being quite sick. They told me about the medications they took, the layers of clothes they wore, EpiPens they kept in their lunch bags, and so on. So I walked away from my master's work with these sort of lingering questions about why these sick people were still at work and getting sicker, in fact, and why hadn't they reported their illness or filed a compensation claim? And so these lingering questions ultimately shaped my doctoral research. So when I set out to do my dissertation research, I decided to examine underreporting. So basically to examine why those crab processing workers didn't report their symptoms. And I discovered through my review of the literature that underreporting is a big problem, with as much as 90% of work-related injury and disease going unreported. So my objective in the beginning then of my doctoral program was to understand how and why injured workers file compensation claims. And I wanted to do this by speaking with both injured workers who had filed and those who had not filed, so I could really access a range of filing experiences and beliefs and concerns around compensation. So I fanned out my recruitment flyer through social media and classified ads and unions and work injury health clinics, as well as through injured worker groups to try and connect with injured workers, as I say, both those who had filed and those who had not filed. But non-reporters didn't turn up. And I suspect this is for the same reasons that they did not file a claim in the first place. So the literature suggests that people who don't report work injury don't do so because they don't recognize their injury as work-related or reportable, or as an injury that's somehow eligible for compensation. And they also don't report because they may have fears that reporting will somehow compromise their job or their income. So injured workers who had filed claims did respond to my recruitment efforts. And so those are the ones that turned up for interviews. And for the most part, they were upset with the compensation process and reported troubled, unresolved claims and unsatisfactory claims outcomes. So I ended up with a naturally occurring extreme case sample that was really fertile for revealing the social dynamics of those more problematic claims. So many of the injured workers in my sample belonged to injured worker groups, and several others knew of these groups and regularly engaged in worker initiatives. So overall, the participants in my sample were more engaged with the system, and they were differently positioned within the system than injured workers who had not filed a claim, or who had filed claims but had a smoother, uncomplicated claiming experience. So I shifted my focus a little, and I began reviewing the literature to see what it had to say about problematic claiming in particular. And what that literature really showed was that 20% of the claims that are filed are prolonged, complex, and adversarial. So they're problematic. And these problematic claims are associated with chronic disability, unemployment, financial and emotional suffering for the injured workers. And they're also associated with significant financial and administrative burden for the compensation board. So while it's a relatively small proportion of claims that are filed that become problematic, as I say, about 20%, these problematic claims are actually estimated to account for 80% of claims-related costs in the system. So I then sort of shifted my focus a little bit and I refined my research interest. So going forward, my objective really was to understand problematic claiming in particular from the injured worker's perspective. And before I kind of go on with the actual study, I just wanted to say a few things about workers' compensation in the event that some of you tuning in aren't entirely familiar with the compensation system. So workers' compensation in Canada is a provincial responsibility, and it's administered by provincial workers' compensation boards. And as Pam noted off the top, my research was carried out in Ontario. So this particular study examines workers' experience with and the particular policies and practices of Ontario's Workplace Safety and Insurance Board, which is commonly known in the province as the WSIB. The system in Canada was established in 1914, and it was based on the recommendations of Sir William Meredith, who was appointed to a royal commission to study workers' compensation. And the system Meredith proposed is widely referred to as a historic compromise, in which workers surrendered their right to sue their employers for injuries or illnesses sustained at work, in exchange for compensation in the form of wage replacement and healthcare benefits. And the foundational elements of Canada's compensation system are really captured in the Meredith principles that are drawn from Meredith's 1913 report. And so they're generally captured in 5 principles. The system, firstly, the system is a no-fault compensation system that was designed to attenuate the adversarial relations between employers and workers by eliminating the litigious civil suit process and administering compensation for work-related injury or illness, regardless of fault. So there's no argument over the responsibility or liability for an injury. The second principle is that there are guaranteed benefits. So there is a fund established to guaranteed funds exist to pay benefits of workers' claims. Thirdly, employers share collective liability for workplace injury. So the system is funded by employer premiums determined by and paid to the administering agency, the Workers' Compensation Board. The board administers the system. It's an independent trust agency that operates independently of the government. And so it's charged with balancing the interests of both employers and injured workers by, on the one hand, collecting appropriate premiums from employers, and on the other, paying out timely and fair compensation to workers with injury or illness. And finally, the Workers' Compensation Board has exclusive jurisdiction over compensation and is the final decision maker for all claims. So who can submit a workers' compensation claim? Employers are required by law to submit a claim for any injury or disease that results in healthcare or absence from work or less than regular pay as a result of the injury or illness. Workers can file if they suspect their employer has not. And healthcare providers are not required to file an injury report, but they can do so if a patient requests it. But healthcare providers are required to submit the requested health information or materials upon request by the board once a claim has been initiated. And throughout my presentation, I'll talk about being on a compensation claim or the compensation process. And by this, I refer to the experiences, events, scenarios, and trajectories that really start with the opening of a compensation claim and ends when the injured or ill worker ceases to interact with the compensation system. So for me, the end of a claim is not defined by when it is closed by the board, for example. I'm interested in that process that may extend beyond the end of the file as far as the board is concerned, when an injured worker may still be engaging with the system through the appeals process or through their active engagement in injured worker groups and so on. So back to my study, my methodology, my overarching theoretical approach was what I call discursive interactionism. So I employed a blend of several macro-level theories of symbolic and structural interactionism and discourse theory to guide my conceptual framing, my methods, and my interpretation of the social dimensions of injured workers' lived experience of problematic claiming. So essentially, I'm interested in how injured workers make sense of their life situations and how they create meaning and construct their identity through social interactions. But I'm also interested in looking beyond those sort of local level interactions, and I'm interested in how the meanings injured workers attribute to their experience may be shaped by the broader social environment. And I'm also really attentive to language and its related role in meaning making. So my analysis here assumes that the language available to people shapes and limits how they generate and express ideas, as well as shapes and limits the actions that they take. So the study employed methods of focused ethnography. Focused ethnographies are conducted to study smaller subcultural units such as institutions or loosely connected groups of people who share, for example, a similar occupation or health condition. So using ethnographic methods of thick description, I carried out in-depth interviews with workers to understand their experiences of claiming within a particular cultural and social context within the workers' compensation system. My sample for in-depth interviews included 10 men and 16 women. There was a range of employment statuses, including 8 employed, 13 unemployed, and then 8 others who were either in modified work, undertaking retraining, working part-time, or studying as a student. The types of work covered office work, trades, healthcare and community work, and other forms of work. And there was a wide range of injuries represented in my sample as well, with 8 with a gradual onset injury, 15 with a more acute sort of injury. There were musculoskeletal conditions, broken bones, exposures, and so on. I also conducted analysis of documents and texts produced by and for, 1, the WSIB, and 2, the injured worker movement. And I did that in order to really access that broader social and institutional context in which workers' claiming experiences play out. For my data analysis, I really moved back and forth between data collection and analysis so that I could pursue discoveries from early interviews and document analysis in subsequent data collection and interpretation. Also so that I could really apply new concepts and frameworks as they occurred to me or became relevant. So I employed multiple analytic devices to see my data more deeply and in new and different ways. So my analytic approaches included post-interview memoing, multiple layered readings, inductive and deductive coding, constant comparison. I investigated deviant cases and conditions of possibility. I generated situational maps, and I also performed discourse analysis. So the central finding of my work was given away in the title, in fact. It's that injured workers in this study understand the compensation process and the attitudes and behaviors of the WSIB and employers morally. They understand it according to socially produced notions of good and bad, right and wrong, and in terms of worthiness. And the injured workers' moral framings of compensation can be seen throughout the study's interview data, in the language workers used, and in the challenges and strategies they noted in their accounts. So I could see their moral experience of claiming expressed in 4 ways. Basically, in their concerns with mistrust, dehumanization, judgment, and confrontation. And I could also see workers' moral engagement in the system and how they seem to respond to their claiming experience by performing identity work. So workers in this study spoke about wariness toward their employers and the WSIB, and examples of injured workers distrusting parties in the compensation process and questioning their interests regularly emerged in the data. So you can see in this first quote that I've pulled out here to demonstrate this concern with trust, where this worker says there needs to be a watchdog over the WSIB that says, okay, when an employer and the WSIB start working together to limit employee claims, the employer or the injured worker can report to this agency, who then oversees it. Injured workers seem to feel dehumanized also by features of the compensation system that they believed neglected or denied their individual and personal or human attributes and needs. They complained that the WSIB's one-size-fits-all approach reflected the board's conception of injured workers as just part of business, rather than as unique individuals needing and deserving help and care. And the second quote shown here sort of demonstrates that concern. It reads, like, it's just, I don't fit into your mold. You're trying to fit, I'm square, and you're trying to fit me in a round mold. And guess what? It's not going to work. So they're going by their program that they set out for everybody, and everybody better line up and just file right in, right? A third expression of workers' moral engagement and claiming was their feeling of being negatively evaluated by the WSIB and their employer, among others, and of being judged as having lower moral worth. Injured workers' perceived judgment associated with their claiming process was visible in 3 key ways. They felt scrutinized, they felt blamed, and they felt perceived as dishonest. And I've selected 3 quotes here to sort of demonstrate those concerns. So workers perceived the WSIB's information gathering efforts and follow-ups as excessive scrutiny, as though they were conducted to frustrate or discourage claimants and to render their claim ineligible. So this person says in the first quote, the next letter I got from the board, they knock him down, they're referring to their doctor there, they knock him down and they said, we needed more information. I gave them the same information over and over and over, enough to wallpaper Toronto 50 times. And my doctor got so disgusted with it, he just gave up and he said no more. In regards to blame, although a fundamental feature of the system is that it's no fault, it doesn't really eliminate the notion of blame or questions of guilt and innocence that injured workers experience. Blame is an inherently moral judgment which injured workers perceived on the part of the WSIB and their employers, oftentimes from the moment they engage with the system. And as this worker notes, it seems that with WSIB, you're guilty till you can prove you're innocent. And there's a perception of people trying to milk the system, even though they put them almost into bankruptcy in trying to do so. And finally, workers, the sort of third dimension of this feeling of judgment is that workers felt they were perceived as dishonest. They perceived that the legitimacy of their health problem was questioned, and they felt that their health records and social relations at work were closely examined for evidence of wrongdoing or inappropriate claiming. So as this worker notes, I'm very fine at documentation. I can trace back 5 years and I can tell you by going through my diary that I was doing 5 years ago on this day. I keep very meticulous notes because the way I figure it is that somebody's going to come back on me and they're going to ask me a question and I'm going to be ready. So this person has developed this sort of habit of keeping very meticulous notes in anticipation of being seen as dishonest or said to be lying. Finally, workers' moral engagement in the system was evident in their concerns with confrontation. Workers' perception of adversarial relations with WSIB personnel and the employers, and their regular use of fight language and metaphors in their claiming accounts. So they often used language like fight, or whose side are you on, or workers' compensation is a battle, and that sort of thing, as you can see here in this quote. So it's a big chain of events that leads down to the fact that, okay, who's fighting for me? And if you don't fight for yourself, nothing is going to get done. But, they throw up roadblocks. They throw up roadblocks that, they can't see you today, or, I don't have the information right now. So finding ways to put you off. I also saw in my interview data that injured workers are performing what I've called identity work. And I see this as further evidence of their moral engagement in the system, but also the response to the perceived degradation of their moral standing. So workers endeavor to manage the assault on their character through the performance of this so-called identity work, to resist these feelings of judgment and stigma and attributions of blame and fraud associated with their status as compensation claimants. So they constructed positive moral identities in accordance with cultural expectations and shared understandings of what's considered to be morally upright. And I borrowed from Irvine, Call, and Smith, who did a study looking at homeless people, and borrowed sort of their framework for examining identity work. And they suggested that there might be 4 activities or tools that someone might employ to sort of rebuild their moral standing. And those are the strategic use of props, the arrangement of personal appearance, the selective association with others, and identity talk. So in regards to props, I could really see that in the interview data when injured workers talked about the documentation. As you saw in the earlier quote there, a lot of the injured workers who came into these interviews had stacks and stacks of files and folders and letters from the compensation board, letters from their doctors, and so on. They kept meticulous notes, very carefully documented every stage of the process, so that if a question was raised, they were prepared. So I saw this as an example of the strategic use of props. I could also see the arrangement of personal appearance in injured worker stories as well. It's not as though I observed sort of faking or exaggerating of injury or illness in the interviews, but I could definitely see workers alluding to the expectations that they act a certain way, that they would either be contrite or look sick or perform their disability in a certain way. And they sort of talked about the need to manage their appearance so that they didn't look too well to be off work on compensation. So the workers noted that their demeanor and their emotions needed to be managed in order to sort of give the right impression and elicit positive responses from the system. So one worker, for example, felt his claim was hampered because he exhibited anger in a doctor's appointment. And he felt that the WSIB really focused on that behavior. So he said, they tried to make me look like a psychotic nutcase because I yelled at the doctor. So they used that, but they didn't mention anything about the medical aspects of the injury. So there's this sort of recognition that how you appear and how you act is important, and you have to manage that. Another injured worker spoke about feeling rushed back into retraining before she was ready, and because she was still experiencing a great deal of pain due to her back injury. So in order to comply with the return to work process, she attended this retraining, but lay on the floor during the session to sort of demonstrate that she was there too soon and that she was in a great deal of pain, sort of making visible an otherwise invisible condition. I could also see from my interviews with injured workers an attempt to associate selectively with others. So I could see the injured workers associating with injured worker groups or sympathetic doctors or professionals to really sort of help rebuild their positive identity and to align with people who could help advance their claim. Finally, I could see the injured workers using identity talk to sort of preserve their social identity and present themselves as worthy of esteem, positive assessments, and other relevant rewards, such as workers' compensation benefits. So workers strategically shared certain information in their accounts of their claiming experience to verbally reconstruct their moral personhood. Their constructed moral identity embodied a number of attributes that they believe are considered morally acceptable. And I highlighted 3. So injured workers framed themselves and talked in a way that presented them as good workers. So they wanted to work, they were physically fit and able to work, and they were knowledgeable about their work. And as this quote here shows, one worker said, "I keep myself fit. I worked out all the time, and that sort of helped me with my injuries." And he talked about how he was able to recover and will return to work far more quickly because he was so fit. The workers also presented themselves as legitimate claimants, those who were doing hazardous work and incurring real injuries. And they often talked in great detail about the specifics of their injuries, the real medical kinds of aspects of it, talking about, which part of the spinal cord had been injured and so on. And they also sort of demonstrated their legitimacy by talking about just how dangerous their work was, as this person here does in this second quote. And they say, "People are quitting the field because it's dangerous, and they didn't expect it would be. We're in a dangerous situation." And finally, the injured workers talked about the real suffering they were experiencing, and basically indicating that being on workers' compensation is not a picnic. It's not something someone would do if they didn't have to. And there's a great deal of suffering experienced by those on a workers' compensation claim. And this worker talks about a conversation he had with another one who was going through a really bad time. And he says, "He told me he was living out of his truck with his children and wife. And the next day on the news, here he went back to that office with a sawed-off shotgun and blew his head off." So there were some really extreme stories of very painful suffering that injured workers told, I think, as part of this identity work. So once I established that injured workers engage with compensation morally and understand it in moral terms, I began to consider what might produce that moral claiming experience, what accounts for it. Why do they experience it in moral terms rather than legal or economic terms, for example? So I began to consider the other sorts of forces and contexts that might be shaping the workers' moral engagement in claiming, which you can see here at the sort of the bottom of this diagram in the orange. So I began to sort of look at discursive influences that might be operating within the workers' compensation system and context. And I considered 3 in particular. I considered the justice discourse of the injured worker movement, which was operating more locally around the injured workers. And then outside of that, more broadly, I considered the influence of a sick role discourse and as well the influence of neoliberal ideas of work and health. So many of the injured workers in this study were connected to the injured worker community or movement and exposed through its activities and texts to a justice discourse, the movement's framing of compensation as an issue of justice and integrity, which I observed in my analysis of the movement's documents and texts. So a significant concern of the injured worker movement relates to integrity. And I could see this in the emphasis on the need to convince the various players involved, and especially those who have relevant power in the compensation system, that injured workers are telling the truth about their injuries, how they sustain them, and what they're able to do post-injury. And one way I could really see this in the injured worker movement was in its creation of an injured workers speaker school in 2007 in Toronto and other areas in Ontario. And the purpose of that school was to really help injured workers to not only speak publicly about their experience, but to do so proficiently and convincingly. The second key concern of the movement that I saw through its documents and texts was its seeking justice for injured workers. So a key strategy of the movement has been to evoke the Meredith report that I mentioned earlier and to call attention to the historic compromise and to emphasize the particularly moral language of Meredith's report that refers to a fair and just system. The texts of the injured worker movement also reveal its perception of the WSIB as being preoccupied with financial efficiency and accountability, and really disregarding the fundamental principles of the system that Meredith founded. I argue that the injured worker movement's justice discourse offered them particular morally oriented language and justice-related concepts for understanding and talking about their situation. So interview data reflected these dimensions of the justice discourse. Interview participants' experiences of claiming included their desire and efforts to be believed and seen as trustworthy. And their references to Meredith's principles and calls for a fair and just compensation system reflect those notions of justice. And you can see that in this quote that I bring up now. And this worker says, I mean, the compensation thing was based on 1912, Sir Meredith, you've heard? And the Meredith report back then was, if a man was injured, he should be compensated. And that's what it's supposed to be, and it's not. What he said back in 1912, I mean, pretty well 100 years ago, it still applies today, but they're not following that. And he's referring here to the WSIB. I also considered the influence of sick role discourse on how injured workers engage with compensation claiming. So sick role is a theory that was introduced by Talcott Parsons in 1951. And importantly, this theory frames illness as a social role with rights and responsibilities. So the theory basically says that incumbents of the sick role have the right to take time away from regular responsibilities to get well, and they have the right to be free of blame for their condition. And in turn, they are expected to have their condition legitimized by medical authority. They're expected to get well and to want to get well, and to seek medical advice to do so. So I argue that the sick role discourse contributes to society's understanding of illness as a moral issue, rather than, say, or in addition to seeing it as a medical or biological one. So the sick role creates expectations of good citizens, those who cooperate with authorities, quickly recover from illness, and resume obligations. And these may be expectations that injured workers are unable to meet. So in breach of the sick role, injured workers often struggle to have their condition recognized by both their doctor and the WSIB. They fail to recover as quickly as the Workers' Compensation Board deems appropriate, if at all. And they experience scrutiny and blame. So they don't even enjoy the rights afforded to people who are sick for reasons unrelated to work. So injured workers trying to meet expectations of the sick role and of the WSIB process may feel a tension to, on the one hand, eagerly participate in their early and safe return to work, and on the other hand, appear sufficiently unwell to demonstrate the legitimacy and extent of their suffering. Essentially, they must strike a careful balance between doing too little and doing too much. And this tug of war places injured workers in an in-between social space, where they're seen as neither sick nor well, and where they experience the moral weight of being unable to assume the rights and obligations of neither the sick role nor the health role. So I argue this experience shapes workers' moral understandings and practices related to claiming. Like sick role discourse, neoliberal discourse frames health and illness in moral terms as well. It shapes societal understandings of what individual attributes and practices are to be commended or discouraged. And I argue that either directly or indirectly through the Compensation Board's policies and practices, neoliberalism imposes expectations of good citizenship, which injured workers may be unable to meet. I'll highlight two dimensions of neoliberalism that contribute to moral framings of illness. The first is market fundamentalism. Neoliberalism champions a competitive market that is free from government intervention and restraint, and relies upon productive, competitive citizens to contribute to a healthy economy. In the neoliberal context, systems of social support are frowned upon and framed as promoting dependence and laziness. So this discourse casts those who are reliant on social supports as drains, and I argue as failed neoliberal citizens. This discourse has also led to tightened eligibility criteria for and surveillance of those who rely on these supports. This consequently can increase the scrutiny and suspicion of injured workers. Secondly, neoliberalism promotes the individual responsibilization of health. So good neoliberal citizens are self-reliant, they avoid risks, they're responsible for their health and economic well-being, and they contribute to the society and wider economy. So neoliberalism then frames health as a duty rather than a right of citizenship. So in a neoliberal context that champions health and productivity through work, injured workers who are unemployed and trying to recover, if they can recover, may be seen and see themselves as failed citizens, and they may be blamed for the injury or ill health, which they were responsible for avoiding. So consequently, there's an increasing effort on the part of sick people to engage in strategies to reassert their moral credentials in order to resist the judgments associated with illness and unemployment, as I have shown in the identity work performed by injured workers. Finally, I considered the mediating role of a workers' compensation board in all of this. And my analysis of the WSIB's texts suggests that the WSIB has taken up the neoliberal discourse, becoming increasingly more business-focused over time and increasingly preoccupied with financial efficiency. I argue that the WSIB is an intermediary of neoliberalism and may play a role in shaping injured workers' moral experience of claiming through its own participation in neoliberal discourse, which defines compensation as a matter of business and sees financial efficiency as a key institutional objective. So in its various texts, including strategic plans and the operational policy manual and various website materials, the WSIB consistently represents itself as a bureaucratic institution. And you can see this reflected in the language throughout those texts. So it describes claimants as customers. It describes itself as easy to do business with. It talks about the effort to transform the WSIB into a modern, sustainable, and customer-centric organization. And throughout its texts, the WSIB emphasizes its decision-making practices that are fair, consistent, equitable, and non-discretionary, and based on up-to-date and clear policies. For me, all of this is evidence of the board seeing its engagement in claiming as a bureaucratic or business exercise. The WSIB's understanding of claiming as a business enterprise is also evident in its adherence to eligibility criteria for adjudicating claims. The WSIB's eligibility policies and practices define who is eligible for compensation and who is not, and factors related to the worthiness or deservingness of the claimant are not considered. And this sort of standardized decision-making reflects the WSIB's bureaucratic stance and elements of the neoliberal discourse that promote operational efficiency of social supports through tightened eligibility criteria. Secondly, my review of the WSIB texts from the past 20 years demonstrates the WSIB's growing focus on financial efficiency. Texts from the early to mid-2000s suggest that its priorities were balanced across workplace safety and injury prevention and financial sustainability. But in more recent years, board texts reflect a different agenda that focuses almost entirely on efficiency and financial responsibility. For example, in the 2012 to 2016 strategic plan, which I've shown just a little sort of visual image of here, 4 of the 5 key pillars pertain to finding efficiencies and addressing the unfunded liability. Only 1 pillar relates to the compensation of injured workers. So as an agent of neoliberalism, I argue that the WSIB's conception of claiming as a bureaucratic enterprise, as opposed to a moral enterprise, as the injured workers conceive it, and its preoccupation with efficiency function to further cast injured workers as bad citizens and drains on the system. So what does all this mean for claiming? I argue that the injured workers and the WSIB's conceptions of claiming are not only different, they are problematically related. The different conceptions of compensation between injured workers and the WSIB, for example, have implications for how each party interprets the attitudes and behaviors of the other. Injured workers who see the WSIB as being preoccupied with finances and efficiency may interpret the various steps in the claim process as being set up to deny claims. They may see aspects of the process as unnecessarily complex and see the system as anti-claimant and full of deliberate roadblocks and deterrents. As you can see here in this quote, where this worker says the WSIB, they probably have a meeting once a week and say, okay, don't let any claims. Don't approve any claims this month. You know, put the roadblocks up. And they were very effective in doing that because they did. Every step of the way, there was like a brick wall, I swear. The Compensation Board, on the other hand, with its focus on administrative efficiency and cost reduction, may view claims as an impediment to cost cutting and perceive injured workers' efforts to access benefits as illegitimate, even suspicious. Injured workers, for example, rather than being viewed neutrally as people availing themselves of their rights to compensation appropriately, may be viewed negatively by the WSIB adjudicators for knowing too much at the outset of their claims or for enlisting professional assistance, such as from a lawyer. So the supervisor of my doctoral work, Joan Eakin, conducted a study of frontline service providers at the Compensation Board. And she observed there that claims adjudicators perceived employers as justified in trying to reduce their premium payments and maximize financial rebates, while the efforts of injured workers to avail themselves of their entitlements and benefits were viewed as evidence of workers taking unjustified advantage of the compensation system or even abusing it. With its focus on bureaucratic aspects of compensation, I argue that the WSIB's attempts to eradicate blame in the system by tightening adherence to policy and eligibility criteria and by depersonalizing the process actually leads to greater scrutiny of injured workers, more denied claims, and the potential to magnify, even if it's unspoken, the issue of blame, which heightens explicit and implicit accusations of blame and hostility between the WSIB and its claimants. Moreover, injured workers who are focused on justice and their own moral standing encounter the WSIB discourse that appears to them to deny their existence and diminish their worth. And as such, I suggest their moral indignation may grow and become further entrenched. Similarly, I propose that the WSIB's efficiency discourse becomes self-reinforcing in the face of injured workers' moral positioning. To adjudicate claims on a moral basis would be unwieldy and discretionary. So the WSIB becomes more and more bound to notions of eligibility and more exclusively committed to its efficiency discourse. So the chasm between the two sides grows even more wide. So I put forward a few sort of, some food for thought, I suppose, in light of the findings of this research, and suggest ways forward for injured workers in the WSIB. And I suggest that the WSIB can consider how its discourse and practices are perceived by injured workers. So the board ought to consider what its public texts convey and whether injured workers feel present in those texts and strategic plans. The board might examine the main sites of tension and ways to improve relations. So what perhaps goes on in terms of relations between frontline adjudicators and claimants to generate tensions, and how can that be attenuated? I also suggest that the board explore ways to align its policies with these prevailing discourses about work and health. And finally, I recommend enhanced communication between the two parties to foster understanding of the other's position. And then in regards to ways forward for research, I think it would be fruitful to further explore ways other compensation policies and programs may collide with dominant discourses, to examine whether injured workers might conceive, claiming, or argue their cause in other terms besides moral terms, and as well to consider the claiming discourse and role of employers. So while my analysis really focused on the compensation board, certainly employers are very much present in the data as well. And I think a lot could be done there to further examine the role of employers. So there you have it. Thank you very much.
Thank you so much, Dana. Your wow, your methodology is so thorough and complex. The presentation was very thought-provoking. We have now 15 minutes, my apologies, before we end the webinar. So I'm going to get straight to the questions. We have three that I will start with. Steve Mantis thanks you for your excellent presentation. In your slide on the sick role, you mentioned that the worker is expressing the challenge of not doing too much, but also not doing too little. This sounds similar to Sherry Torchman's recent paper, which describes other income support programs where doing worse means doing better, and doing better can mean doing worse. Do you think, what do you think of this?
Yeah, I mean, I sort of framed this in my dissertation as this dilemma, right, of trying to meet all of these sort of competing demands on injured workers. So, you know, we have this program now of early and safe return to work in Ontario, where the sort of discourse is that the earlier you get workers back to work, the better that is for their recovery outcomes, ultimately. So injured workers are sort of compelled to comply with this sort of return to work program, even though they don't feel ready. But at the same time, they're also met with, you know, a lot of suspicion and scrutiny around the legitimacy and extent of their injury to begin with. So there's this competing sort of demand to appear sufficiently unwell, while at the same time appearing sufficiently interested in and ready to return to work as quickly as possible.
Mm-hmm. Okay, and Steve continues actually, I'm wondering if this tension is part of the neoliberal approach to policymaking.
I think it is. I think it's certainly shaped by that, right? You know, the effort to get injured workers, I think, off of claims more quickly is certainly a neoliberal effort, or evidence of that neoliberal sort of notion around, you know, pulling back of state intervention and so on, and making sure people are self-sustaining and responsible for their own health and contributors to society and so on, and making sure people are less reliant on these social supports. So I think in many ways, a system that, you know, is trying to get workers back to work as quickly as possible, you could suggest, is partly shaped by those neoliberal discourses.
Mm-hmm. Over the past 40 years, Steve continues, there's been an increasing practice at WSIB and WCB of not dealing or meeting with the injured worker in person. Is this part of the move to efficiency, do you think?
I think so. You know, the board is always talking about becoming this sort of modernized, customer-centric organization, business entity of sorts. So I think, that's, I'm sorry, can you repeat the end of Steve's question there?
Yes. Do you think that not meeting or dealing with injured workers in person is part of the move to efficiency?
Yes, yeah. I mean, I think the board oftentimes reframes it as, you know, trying to sort of move through claim adjudication more quickly and triaging more quickly. So if you just have a phone call, we can basically sort out the claims and make sure we're moving through that backlog more quickly. But you can see as well, of course, how it might operate to, cut costs for the board as well.
Mm-hmm. Okay. Tom McKenna asks, in terms of the underreporting, do you find a reporting or underreporting difference between workers in regular employment versus workers in precarious employment, for example, casual or temporary? And what about workers who have ESL issues?
Yeah, for sure. The literature definitely suggests that more vulnerable workers are even less likely to report than those who are in more traditional, working arrangements. So you will definitely see greater underreporting amongst those who are precariously employed, new Canadian workers, certainly undocumented workers. It's definitely a more likely, or there's a greater rates of underreporting under those sort of more vulnerable working groups. I remember interviewing or speaking with a physician in Toronto who worked with a lot of sort of immigrants and undocumented workers, and there was mention of one who actually had an amputation rather than report it. So people have very have great fears and concerns around compromising their income and their jobs or future employability. If you take into account, temporary foreign workers, they're very concerned about not being brought back to work again if they report or file a claim.
Mm-hmm. That's shocking, actually, and really tragic. So Kier Munn has a question. He's from OWA in Toronto, and he thanks you for your insightful presentation and asks, what do you believe would motivate the WSIB to engage in meaningful discourse around the moral hazard inherent in their processes and policies, as their clearly stated goal is to spend as little resources as possible, so as to reduce the cost to their customers and the employers?
So what would motivate the board to
engage in a meaningful discourse around moral hazard? We can also go ahead.
Yeah, I think, creating that space to hear from and sit across the table from injured workers, and to have, that meaningful conversation, and to truly understand their experience of compensation, to hear about the suffering, and that, because there's this assumption that if we make this sort of compensation available, more and more people will see fit to take advantage of it.
Right.
And so I feel that in my findings, and injured workers so often describe the suffering they've experienced as a result of filing for compensation. You can't help but wonder how you could even assume going forward that someone would try to take advantage of the system that has created so much trouble for them.
We have 7 minutes left, so if anybody has any other questions, please post them now. And one has come in, so actually Tom has maybe a statement as opposed to a question. Within an aging workforce and more workers working past 65, this is a question, is there a trend to underreporting in this group?
Goodness, I'm not familiar with that particular literature around aging workers. So I'm sorry, I can't answer that question. I mean, I could speculate. I'm truly unsure about aging workers, around whether they would feel vulnerable. I mean, perhaps they have fears around perpetuating this discourse that aging workers might be more susceptible to injury in the first place. So they certainly wouldn't want to be an example of that. I can imagine the concerns they might have around filing, but I'm really not familiar with the evidence around that.
Okay. Well, it may be a topic for further research. So Sally Kimpton asks, well, first of all, excellent presentation, Dana. I'm wondering if you could say anything about the effect of WSIB discourses on the health of injured workers, which must certainly be costing both the worker and the system more money.
Yeah, I mean, there's certainly a wealth of information or literature, examining the consequences of being a workers' compensation claimant in Ontario. And health impacts are pretty significant. Certainly physical and mental health impacts, strained relationships, and breakdown of marriages and that sort of thing. So the health impacts are well documented in the literature. The health impacts of the discourse in particular, I would say, would be fairly similar. Certainly, the mental health impacts, I think, of being, perceiving this discourse that you're a cheat, or you're lying about your work injury, and you're, a failed neoliberal citizen, and that sort of thing. You can imagine the mental health impacts of reckoning with that sort of discourse that you're very much aware of.
Okay. There is actually another question coming in. It's just been delayed for a moment. So while we're waiting for that question to come in, I'm wondering if we can go back to Kira's Munn's concern about the discourse. Mm-hmm. And I wanted to piggyback on that and ask do you think that engaging in a moral discourse about injury claims has that created a situation where the board is now more reluctant to deal with injured workers? I wonder if that's they're resistant to dealing with claims because of the moral stance that's being taken.
Mm-hmm. Yeah, I mean, I sort of make that argument in my dissertation that, that is a potential consequence of injured workers pursuing this moral argument around claiming, is that for the board to entertain a moral adjudication process means essentially, what would that look like? It would be incredibly messy. They'd have to abandon these sort of very standardized, non-discretionary practices that they currently hold on to so tightly. It's very important that the board be seen as adjudicating claims in a fair, equitable, transparent, non-discretionary manner. So how do you reconcile this call to consider claims from a more moral positioning?
Right.
So so I argue that the response to that then is holding on more tightly to these eligibility criteria and standardized practices to sort of resist the suggestion that they ought to be adjudicating claims from a moral position or considering notions of deservingness or worthiness.
Right. Well, thank you for expanding on that. You did touch on that in your presentation. Mm-hmm. We do have one more question. It has come in, but I want to quickly sort of extend that line of questioning by asking, are there, I know that in the social assistance system, workers have discretion, and I wonder if the same type of practice is happening in WSIB. Are there moments within adjudication or managing of claims where workers' discretion will, be used to make decisions as opposed to going by the book?
Can you give me an example of what that worker's discretion might look like?
The 20% of claims that are problematic, that are being turned down, mm-hmm. Do you see this consistently across the board with every worker, or do different workers treat it differently, handle the cases differently?
Do you mean the adjudicators or the injured worker claimant? Sorry.
Both. Injured worker, the workers that first see the claims before it even goes to adjudication.
Right. I'm not sure how to answer that question. I guess, I refer back to actually my supervisor, Joan Eakin, who conducted a study, within a workers' compensation board and observed sort of adjudicators' work and noticed that, there were instances of using discretion despite the public sort of, representation that it was all very non-discretionary standardized practices. But when push comes to shove and things get very busy and claims are very messy, there are moments where an adjudicator will use discretion to kind of make decisions around a claim and so on. Mm-hmm. I don't know if that answers your question or not.
It does, and I would love to get into it further, but we're running out of time, and I do need to get to Karen's question. She says, were the findings presented or shared with workers' compensation staff and leaders? And what was the interpretation of the workers' spoken moral claiming experience?
Yeah, so I haven't given a specific presentation to board representatives yet. That's sort of on my, a must-do for me to make sure that this sort of gets into the hands of people who might consider it. So I haven't gotten any response, in fact, to my interpretation of the injured workers' stories that I heard through my research. Yeah, at this point.
Okay. Well, what I'm wondering, the second part of that question was what solutions were found together, but if you haven't had that conversation, I guess that is yet to be determined. Okay. If anybody has any other questions, and Dana, would you mind if I sent them to you, if they forwarded them to me?
Of course, yes, and my email address is here as well. I'm very happy to receive any emailed questions and to continue the conversation further. It's a little bit of an interesting dynamic here where I'm just, reading a question and not able to have a conversation. So I very much invite a conversation with anyone who wants to continue.
Okay. Well, thank you so much, Dana, for your time, and thank you to all our members who attended today's webinar. We look forward to seeing you again in April. Have a good day.
Thanks so much.
Thank you. Bye.